Hello, my name's Julie McCrossin. Welcome to this series of conversations with people who are working to improve access to clinical trials for everyone in the community. And this series is hosted by the GI Cancer Institute. In this episode, Dr. Sabe Sabesan, Director of Medical Oncology at Townsville Cancer Centre in Queensland, explains why the teletrial model is the absolute key to improving access to clinical trials for rural and remote patients. Why will the Australian teletrial program improve access to clinical trials for people in rural and remote areas?
Firstly, teletrial model is basically using telehealth technology. You connect primary sites and satellite sites, big sites and small sites. So that's all it is about teletrial model. So what that does is now the rural, regional, and remote communities that are already disadvantaged can link to the big sites using the teletrial model. And that's why we believe that the teletrial program will improve access to all Australians by creating linkages.
What do you want health clinicians who are watching this to actually do to make a difference? So the people who are missing out on clinical trials now get access. What do you want them to do?
Because we have the teletrial model, our clinical colleagues have opportunity to provide their clinical trials to other sites. So all we want them to do is to collaborate with multiple sites using the teletrial policy and the model so that their trials are available to other sites. So that's all we want them to do, is to use the teletrial model.
Give me an example of a clinical trial involving telehealth, a teletrial that worked and made a difference in getting access to new people.
I'll tell you about our first pilot trial. This was a breast cancer trial where we tested two different medications. And when we had the trial in Townsville, we were struggling to recruit. And at the same time, patients from Mackay, Mount Isa, Cairns, and Torres Strait didn't have access at all. As soon as we activated the teletrial model and connected the whole sites with Townsville and created the North Queensland cluster, the recruitment number actually went to 10. That shows us that you can not only increase reach, but you can also improve the recruitment rate faster.